So I welcome you all in this research group. I am very glad to have you all on board, and I am hoping that you all would be very committed to your projects and would finish it on time. So, the goal of our lecture today is I would give you a general overview of research articles, and then I would give you an overview of systematic review because the type of research articles we would be writing would be systematic reviews. So, and also I would tell you how to select topic for your research article. Topic selection is our task of the week. So, let's start. Hmm. So there are different levels of um, there are different types of research articles. For example, case reports, case control studies, cohort studies, RCTs. So what is this? This is the level of evidence pyramid. If you want to research the literature about certain disease, then there are a few articles that are of highest value and there are some articles that are of the lowest value. So the articles that are on the lower side of this pyramid are the least important, and the articles that are on the top of pyramid are most important. So animal studies and case reports are least important. In case reports, we um, uh, tell about some rare disease, and if it's more than one case, then it's a case series. Then case control studies, cohort studies, and RCTs come at the middle of the pyramid. These studies are conducted by real life data. Systematic reviews and meta-analysis come at the top. So question is why they come at the top? Because these studies are conducted in individual centers or by an individual researchers. And some studies say, for example, if different researches are conducted on efficacy of a new drug um, for a treatment of certain disease, and some randomized controlled trials say that this drug has a positive outcome and it is very efficacious, and some articles say that this is not very efficacious and it has not positive outcome and it is not safe. So, how do we know that which articles to believe? So, in systematic reviews, we collect the data from randomized controlled trials and cohort studies about that specific drug, and then we select high quality articles from them that are of highest value and that have least risk of bias. Um, and then we make a conclusion from all of those articles, and then we tell that if that drug has positive outcomes, if it is safe, or if it is efficacious. So if you have to research the literature about certain disease, you have to first look at the systematic reviews and meta-analysis, and if you don't find anything, then you can keep coming down. So this was general overview of different studies. So what is a systematic review? As I told you earlier that in systematic review, we search already published databases and we select high quality articles, and then we make a conclusion from those articles on the specific research topic we have. So for writing systematic review, there are specific guidelines. We call them Prisma guidelines. I would share the PDF of Prisma guidelines with you. There is a simple guidelines or a simple checklist, and then there is an expanded checklist in which the previous one is explained in detail. In systematic review, method and result sections are mandatory. Quality check is compulsory. We do quality check when we finalize research papers. For example, we finalize 20 articles. So we do quality check of those papers because some papers have a bias in them and they're not high quality papers. So we keep the percentage, like we select the articles greater than 80% or 90%. So we keep a criteria like 80% usually, and all those papers that are more than 80% quality check percentage, we only select those articles. So that is mandatory in systematic review. And inclusion and exclusion criteria is needed. I will tell you in later slide what is inclusion and exclusion criteria. So systematic review is somewhat similar to traditional review and meta-analysis, but there are few differences. In traditional review, there are no specific guidelines. Some people find it difficult to do the quality check and follow the guidelines, so they convert their paper to traditional review. But we will try to have all our papers on systematic review because traditional review is not that um, is not that important or don't have much value as a systematic review. So, and meta-analysis is almost similar as systematic review, except that it has a control group and it involves statistics. Control group is a comparison group, like you are studying other drug treatments with comparison to insulin in diabetes treatment. So the insulin is the control group and oral drug treatments is your case group. So in meta-analysis, it is mandatory that you have a control group. In systematic review, you can have a control group, but this is not mandatory. So while writing our systematic review, we will do it in three phases. Our phase one is planning and selecting a research topic and deciding our inclusion and exclusion criteria. After finalizing our topic, we would do the search strategy and we would select our final articles. That is phase two. It is the longest phase of our research writing. And phase three is writing our paper result and conclusion method and the conclusion of the paper. So these are the parts of the research paper. This is the general overview of what would be the headings of your paper. Later on, you would know what to write in abstract, what to write in introduction, and how to write methods and result discussion section. So this is just a general overview of what would be the parts of your research paper. And so we had a general overview of different types of research articles. What is a systematic review? Now we are starting our systematic review, and our first task is topic selection for our research paper. So for your topic selection, you have to think of the area of the medicine or the diseases that you find interesting, and you have to combine different aspects of that topic, and you have to come up with the final topic. For example, you can combine disease one with disease two. You can think of risk of myocardial infarction in multiple sclerosis patients. So it would be combination of disease one and disease two. We call it concepts. One concept is risk of myocardial infarction, and second concept is in multiple sclerosis patients. So you can have two or three concepts in your research question. So you have to combine two or three aspects, and then you have to combine them to make your research question. For example, you can think of a disease and you can combine it with its signs and symptoms. For example, unusual presentation of stroke. So it would be combination of signs and symptoms with disease. Or you can combine certain disease with drugs. For example, novel treatments in cardiac failure, or um, how to decrease mortality in cardiac failure patients. So it would be combining prevention with certain disease, like how to decrease mortality is prevention, and combining it with disease like cardiac failure. Diagnosis, you can make a research question like missed diagnosis in transverse myelitis patients. So this is how you make a research question, and you can also come up with these areas as well, like prognosis, prevention, incidence, prevalence, etc. I will give you examples of some research questions. So These are my few research papers, and mm, here it is comparative mortality rates of vasoconstrictor agents in the management of hepatorenal syndrome. So you have divided in concepts. Com- Comparative mortality rates is concept one, of vasoconstrictor agents is concept two, management of hepatorenal syndrome is concept three. So I told you that you can have two concepts or three concepts. So this is an example of a combination of three concepts in a research question. Um, Here is another one. Food additives impact on gut microbiota and metabolic syndrome. So this is two concepts, combination of two things. One is food additives impact on which. Second is gut microbiota and metabolic syndrome. So these are combination of impact of food additives on this one. These are two concepts. Similarly, efficacy of diclofenac and indomethacin is concept one. Efficacy of two drugs for prevention of post-ERCP pancreatitis. This is prevention of post-ERCP pancreatitis, and we selected a drug, efficacy of diclofenac and endomethacin. Similarly, effect of vitamin D supplementation on thyroid hormone levels in patients with autoimmune thyroid disease. So these are combination of three concepts. Effect of vitamin D supplement, second is on thyroid hormone levels, and third is autoimmune thyroid disease. So this is an example of a combination of three concepts. And this one is exploring adalimumab's efficacy and safety for migraine prevention. So one is the drug adalimumab efficacy and safety, and second concept is in migraine prevention. So you have to come up with two concepts and you just have to combine them. Any drug with treatment or two diseases, or I can give you some more examples on PubMed. You have to write PubMed and open it. It is a database where you find most of the published articles. For example, you are interested in GIT. We can write mm, medicine resistant GERD, and we selected meta-analysis and systematic reviews uh, to see already published systematic reviews. So this is a systematic review and meta-analysis of the actually research topic is efficacy of vonoprazan for proton pump inhibitor resistant GERD disease. These are two concepts. One is the efficacy of vonoprazan, and second is medicine resistant GERD disease. Similarly, treatment response with potassium competitive acid blockers based on clinical phenotypes of GERD disease. So we have combined treatment response with potassium competitive acid blockers, one, and second is on clinical phenotypes of GERD disease. These are the two concepts. Similarly, baclofen as a therapeutic option for GERD. We take a disease GERD and combine it with a drug baclofen as a therapeutic option. So a systematic review of clinical trials means that they have included all um, randomized clinical trials in their systematic review. Obesity and esophageal cancer. These the combination of two diseases. Like I told you earlier, you can combine two diseases and make a research question. We can see other examples. For example, cardiac failure. So This is pharmacological treatment of heart failure with reduced ejection fraction. So one concept is pharmacological treatment, and second is heart failure with reduced ejection fraction. Similarly, exercise-based cardiac rehab in patients with reduced left ventricular ejection fraction. The one concept of one disease that the articles took is reduced left ventricular ejection fraction, and the second concept is exercise-based cardiac rehab. So, what is the effect of cardiac rehab in reduced left ventricular ejection fraction patients? So, what is the outcome? Similarly, resistance training in heart failure patients. It is also the combination of two concepts, heart failure patients and effect of resistance training. So these are the examples. We can have some few more so that you are very familiar. Cloning and target. So this is physical activity for chronic pancreatitis. This is also one concept. The disease we took is chronic pancreatitis, and the effect of physical activity is the concept too. Similarly, chronic pancreatitis is a risk factor for pancreatic cancer. So one concept is chronic pancreatitis, and second is it is a risk factor for pancreatic cancer. And the study also included incidence increases with duration of disease. You don't have to include any additional or third concept if you find it somewhat complicated, but you can have three concepts as well. This is also two concepts, biomarkers of chronic pancreatitis. This is chronic pancreatitis is concept one and biomarkers is concept two. These are the guidelines. And this one is the combination of signs and symptoms with the disease. So prodromal signs and symptoms of chronic pancreatitis. This is combination of two diseases, prevalence of osteopathy in chronic pancreatitis. So I think these are enough examples. You just have to think of two concepts and you have to combine them. So we have to follow PICO-TT criteria in which we have to have a patient population. For example, as we just discussed, we can have chronic pancreatitis patients and intervention like diclofenac or indomethacin in like we had a research article about indomethacin and diclofenac effect in prevention of uh, post ERCP pancreatitis. So population would be post ERCP pancreatitis, and intervention is diclofenac and indomethacin, and outcome is prevention. So time and type of study, while you would be doing the data search, you you would either select the articles from the last 5 years, or if the articles are very few, you can select from the last 10 years. And all the articles, all the data sets that you would do, they have to be either from the last 5 years or from the last 10 years. It should be consistent in all your data research. And so time and type of studies, you either include observational study or randomized controlled trial or both of them. So you have to mention that. This is what we already discussed. You have to think of the area that you're passionate and you have to combine different aspects and then come up with a final topic. You can come up with 2 to 3 different topics and then select one topic at the end, and you can share with me different topics, and um, we can choose one topic. These are also examples of the questions, and you can just read them. It's all that we have already discussed, that how to make a research question, like how many people are diagnosed with colorectal cancer yearly. So one concept is colorectal cancer, and how many people are diagnosed is concept two. Um, And the example of prevalence is how many people are currently living with any particular condition. For example, stroke. So concept one is stroke, and how many people are currently living with stroke, how many people is concept two. And these are all just like that. So we have discussed enough about topic selection. Now we have to decide inclusion and exclusion criteria. So for inclusion and exclusion criteria, we have to tell whether the papers we selected are peer reviewed. Peer review is when you submit an article for publishing, it goes through the process of peer reviewed, in which some people review your papers and they look for any mistakes, any errors, or biases in your paper. If your paper is peer reviewed, it is more authentic. If it is not peer reviewed, then it has possibility of having errors. So you should include peer reviewed papers in your data search and in your systematic review. Age of literature, just as I told you earlier, that we would either select articles from the last 5 years or from the last 10 years. And gray literature is the research articles that are not published. They are only present in libraries, etc. So, and they are not usually found on PubMed or other databases. So you have to write in your criteria that if you have included gray literature or not. Then study type and design. As I told you, if you have uh, clinical randomized controlled trials or observational studies in your research papers, you have to mention them. Population is whatever your research question is. You have to mention that patient population, for example, chronic pancreatitis patients or diabetes patients or migraine patients. If your paper has specific location, for example, in Asia, in America, in Japan, so you have to mention, and if it doesn't have any specific location, then you don't have to worry about that. Language, we usually select only English language papers and full text articles. Abstract is actually the summary of your whole paper. So some papers are not freely available. The full text articles are not available. We only can have abstract of them. So we prefer to include full text papers. So you will write inclusion criteria as my paper has peer-reviewed articles from the last 5 years, or randomized controlled trials, and whatever is your research question, you have to add the according to PICO-TT criteria that all patients with chronic migraine and intervention is like my paper was arinumab, efficacy of arinumab in migraine prevention. So you have to write inclusion criteria that all patients of chronic migraine um, who were given arinumab as an intervention, and the efficacy is the outcome, efficacy and safety. So inclusion criteria should include this one and the PICO-TT criteria. I can give you an example of this inclusion criteria. Like, for example, this is my paper. So we will open full text. So eligibility criteria for inclusion require that studies involve patients diagnosed with chronic or episodic migraine according to ICST 3 criteria. The studies needed to focus on use of arinumab as the intervention. Um, Only published freely accessible full text articles in English from the last 5 years. These are all the things that I told you in slides that you have to include, and study type or prospective observational studies were considered. So it all depends on your filters, and you will write it when you will do data search, and you will include articles from the last 5 years of full text or whatever. So you would write it according to that. And so You have to select a topic and you have to read about it on PubMed, or you can come up with different topics and read about it on PubMed. And you have to finalize one topic till the end of this week. And you have to create an account on PubMed. I already told you PubMed is a database in which you can find most of the published articles. Then you have to create an account on EndNote. EndNote is used for references. Right now, I will tell you how to create an account on EndNote. Um, and later on in later lectures, we will figure out what to do with EndNote. And we also discussed about inclusion and exclusion criteria and keywords. So let me give you an example. So this is the paper exploring erinumab's efficacy and safety for migraine prevention in real-world settings. So this is exploring erinumab efficacy and safety is concept 1, and migraine prevention is concept 2. Real-world settings means observational studies. So this is first I would like to give you a general overview of this paper. This is abstract, that is summary of the whole paper, and then these are the keywords. If you are using specific intervention, for example, specific drug, you cannot have many similar keywords. Keywords are important so that people can find related articles by just using the keywords. If they want to find articles on anti-CGRP antibody for migraine, then they would just write the keyword and all the articles with that those keywords would appear. You would also research the databases using keywords, and you also have to include keywords in your paper. So for myself, it was erinumab. And like I told you, for specific drugs, you cannot have many keywords because it is the drug name. You can just add the group name of that drug, for example, anti-CGRP monoclonal antibody. The second concept was migraine. So I had more keywords for that, like treatment resistant migraine, episodic migraine, chronic migraine, or just migraine. So whatever research question you finalize, you have to research on Google and read related papers, and you just look on the keywords of those papers, of the related articles, and then you can come up with your own keywords, or you can take the keywords for your paper. So this is general overview of the paper, introduction and background. In introduction and background, we write what already has been researched on that topic. Why are you doing your research, and what would you add in the literature by doing this research? So this is the just introduction and background of the already research data on that particular topic. Then methods. This is the inclusion criteria that we already researched. Then in the next lecture, we will see how to do the literature search. We would select the studies, we would do the quality assessment, and then we will write the paper, results, and conclusion. In results, we discuss the study characteristics we selected and their outcomes. And then we write the discussion section, the finalized conclusion of our paper, limitations of the paper, and conclusion. So this is general overview. So we talked about different types of articles, what is systematic review, how to choose a topic, and your task of the week. Select a topic, read on it, find your keywords, inclusion and exclusion criteria. So PubMed and EndNote, let me tell you how to make an account. PubMed, open it and log in from here. There are many login options. You can log in with any of these. So your Google account or Microsoft accounts or just anyone. So I logged in with my Microsoft account. This is important because if you don't log in, your research data won't be saved. So this is logged in with my email. Next is EndNote. you have to write EndNote Web and you have to log in. There is this EndNote Online Classic. We use it. It is freely available. I have already made my account. You have to register it as a new member. And you would have all your references on EndNote like that. We will discuss it later on how to transfer your references in EndNote and how to use them. But right now, you just have to make an account. So I think we have covered everything for today.